What does the color of your feet say about your vascular health? Hi, I'm Dr. Gary Rothenberg, a podiatrist and director of medical affairs for Podometrics, a diabetic foot diagnostic mat company. I'm coming to you this week with your medical notepad brought to you by Cardiovascular Systems Incorporated's patient advocacy campaign, Take a Stand Against Amputation and the Way to My Heart. Today, we're talking about the color of your feet. Skin discoloration can occur to the feet and legs for a variety of reasons and can range from pale white to dark black in discoloration. Of course, we have to take into account the patient's normal skin tone, and it's a relative change in the skin discoloration that could be, again, white, purple, blue, or even dark black in discoloration. Some of these, again, based on the person's usual skin tone, can be very obvious or they can be particularly subtle, and we have to pay close attention. Skin discoloration can occur for a variety of reasons, including dermatologic conditions such as eczema or psoriasis, or even skin cancers cause skin discoloration. There are also systemic issues like diabetes and peripheral arterial disease or infections that can cause discoloration as well. We all have also bumped our little toe on the nightstand and it turns usually purple, yellow, or even black from discoloration of trauma and bruising. So we do oftentimes want to pay particular attention to the discoloration, but also to any potential symptoms or signs that are associated with that discoloration. So what do I mean by that? We want to know, is there also temperature changes? So does that area of brown discoloration or purple discoloration also feel particularly cool or warm to the touch? Cool may be a sign of poor circulation. Warm may be a sign of infection. What about also, is there swelling in that local area? Or is there a break in the skin? Are there bumps? Is there drainage? So not only do we want to pay attention to the discoloration, but it's like putting a puzzle together with other signs or symptoms as well. In particular, those at risk for developing peripheral arterial disease and diabetes, usually we look for skin discoloration along the legs or the feet, and some common conditions may be venous insufficiency. Also, these generally present as purple or brownish patches on the lower extremity and are commonly associated with swelling and even can blister and open up into open sores. Cold discoloration, which can be either bluish or purple discoloration, those can be a sign of poor circulation. So generally, again, we feel for pulses in the foot to make sure that the circulation is appropriate. I also like to emphasize that sometimes skin discoloration is temporary, and that's what we expect. So, as an example, you might be caught outdoors for a longer period of time than you expected on a cool day. You come home, and there may be some purple discoloration to your feet. Well, the next morning when you awaken, I would presume and assume that that discoloration has resolved. So, again, these things that persist, that have other associated symptoms, those are particularly concerning to me as a provider, and I would encourage you to discuss with your healthcare provider. Again, I'm Dr. Gary Rothenberg. For more information on peripheral arterial disease, go to standagainstamputation.com. And for real-time support and advocacy, go to thewaytomyheart.org. Remember, the information provided in this series are for educational purposes only. Don't act on any information provided without the explicit consent of your healthcare team who knows your situation best.